Ayana came in on referral from one of the teachers at her school, and the main concern of both Ayana and her parents was the tremendous difficulty she was having with reading and other academic subjects.
It's pretty easy to see that she really has trouble, reading and writing. She often will read the wrong line, read the wrong word, write on the wrong line, spell things wrong.
I put in words that are not supposed to be there. So I'll put when there's an A, I'll put it.
In addition to her basic myopia and eye optics issue, we found that she definitely had a lot of difficulty tracking with her eyes, that the ability to move her eyes independent of head and body was very, very low. And so she tended to read by moving her head rather than moving her eyes. I found that her eye focusing system had very little flexibility. So it might have taken her 15 or 20 seconds to get clear from looking at the chalkboard to a workbook or a workbook back to the chalkboard. She definitely tended to overturn or over-converge her eyes when doing near-point work. And that would make her tired and fatigued very, very quickly.
My mind didn't make sense of the reading.
So as a primary care optometric physician, what can you look for in diagnosing a binocular vision dysfunction? Certainly, you want to first ask Mom, how's Jimmy doing in school? And if Jimmy's doing great, you don't need to go any further. If Jimmy's struggling or not working up to their potential, check if they're skipping words, missing words, misreading words, losing their place a lot when they read. Are they moving their head rather than their eyes rather than when they read? Do they have to follow with a finger or marker to keep their place? Are they experiencing frontal and occipital headaches from reading or at the end of a school day? Do they have asthenopia symptoms from school and reading? Eyes burn, itch, ache, tear, get excessively tired. Are they complaining that the print blurs or fades out over time? Is diplopia present? Are the words actually beginning to pull apart when they read? And if the answer to these symptoms is yes, then the likelihood of a binocular dysfunction is great. Check your extraocular motilities to see whether they're over or undershooting. Make sure the near-pointed convergence is within the normal ranges. And if all of these seem to not be as expected, it's time for a referral.
The vision therapy has seemed to improve her visual tracking ability.
Again, as we saw in the film at the beginning, it was totally and completely head movement. She had absolutely no idea how to move her eyes independent of her head and body.
I can see what they're writing on the board. Everything used to just look like a big blur. They're not all over the place. They're staying together. They're not splitting the words.
Very, very big improvement in her ability to converge and diverge her eyes, so that not only can she keep the print single when she's reading, but she can shift easily now between chalkboard work at distance and then be able to go back and forth between that and whatever she's working on.
She no longer skips lines and things like that, so she's reading more accurately, she's reading more quickly, and she's understanding.